So we need three things to survive. You need food, you need water, you need dopamine. Now, some of the people who get a little antsy say we also need oxygen. Yes, well, we also need skin, but I'm not going to really talk about that today. We're going to talk about the three things we absolutely need to survive as a human in today's world, and that is food, water, and dopamine. We need dopamine because it's the chemical responsible for motivation. It's this thing that's responsible for us going and making a friend, having a mother have a bond with a baby. It's the thing that motivates us when we do good to do better. When somebody pats you on the back and says, "Good job," and you go to do something more significant, that's because your dopamine has gotten pinged and it's just something pushing you, this invisible chemical that's pushing you along the path. On a normal day, we even know how much dopamine we're supposed to have. So on Monday morning, when I wake up and I have to get up and I go to work, I live in the range of about 50 nanograms per deciliter of dopamine. That sits in the central part of my brain, and that's required for me to get out of bed and go get that first cup of coffee. Now, what about the worst day? The really bad day? The day you call your office and you fake vomit in the phone and you decide not to go in. You're like, "I just can't make it." That's about 40 nanograms per deciliter. So not much lower, but low enough to where you just want to sit around in your pajamas all day and do nothing. What about the best day ever? You know, the day where all at once you win the lottery, you have 2% body fat, and you're living on the beach. All of those things happen at the exact same time. We even know that one. That's 100 nanograms per deciliter. Our brain is meant to go all the way to there. It's not really meant to go above. And we can look at things like your favorite food, which is like 94 nanograms per deciliter. And sex, 92 nanograms per deciliter. Bummer, right? Couldn't have predicted that. Maybe they need to redo that research. But at the same time, we know that we're supposed to live within this relative normal state between 40 on a horrible day and 100 on our best day. So what happens when we add a chemical into the brain like methamphetamine? This chemical is really important because it pushes us way past that 100 nanograms per deciliter. In fact, it actually pushes up to 1,100 nanograms per deciliter, more than 10 times the amount of dopamine that our brain should be making. And then, if we look at things like marijuana or alcohol or heroin, these are things that push it up into the high hundreds. When you've been taking things like methamphetamine for a long time, every time that you take the methamphetamine, it goes from 1,100, then the next time maybe it's 900, then 600, then 500, then 200, then 100. Then you're required to take that drug even to get you up to that normal level of 50 nanograms per deciliter. Let's say we found this person, we get them into treatment and we remove that drug. Now we have people whose dopamine goes all the way down to as low as 10 nanograms per deciliter. And on their best day ever, it's only 20 nanograms per deciliter. These are numbers that matter, and we're going to keep hammering on these because when you have 10 nanograms per deciliter, you can't get out of bed. You can't get up to put your clothes on and go to a job interview or to even take care of yourself or your family. When we lack dopamine, the body craves it. And when you crave dopamine, you get into survival mode. And that leads to primal action. And that primal action is a lot of times the behavior that we see. How can they take grandma's jewelry? How can they steal a credit card? How can they pawn something that they owned? Their brain is telling them that they are not going to survive if they don't get dopamine. And the thing that gives them the dopamine that they need, as far as they know, is that drug of choice. When we look at craving, which again is what drives a lot of this behavior, we actually have good data around craving and how that looks. So when we look at functional MRIs of the brain, this is a picture of the brain, and we can see areas light up, and these areas light up, consistent with what part of the brain is working and how hard it's working. We had patients who were dehydrated, were in starvation mode, and had not received their drug of choice for a period of time. We had patients who hadn't had anything to drink for 3 days. That's a long time. And these are patients who are starting to get to the point of dehydration where it's going to be survival need for water and not just I'm a little bit thirsty. So for these patients, we looked at a functional MRI, we put them in the tube in the MRI, and we would ask them questions like, tell me about a waterfall. We would play, sounds of waterfalls in the background, and we would sprinkle water on their feet and take pictures of the brain. And we can look at these areas of the brain that are responsible for craving, like the anterior cingulate gyrus, the one we talked about earlier, and it would light up to about the relative size of a baseball. We did this for food. So we had patients who didn't get any physical food per oral, meaning they didn't eat any food for 5 days. They would get some IV fluids and some vitamins because we don't want to kill people that we're trying to test. But at the same time, 5 days without food. And then we put them into the functional MRI. We then talked to them about their favorite food. We then brought their favorite food into the MRI suite and we kind of wafted it into the MRI tube so they could smell it. And then we have them talk about how it would taste. And then we had them taste it and spit it out. And through all of these, we looked at the brain through this functional MRI. And in those same areas, instead of a baseball for dehydration, we had the size of about a basketball for starvation. So we know what people will do when they're dying of thirst or they're dying of starvation. I mean, they will rob, they will steal. I mean, imagine if you walk through the desert and in 3 days' time, you walk through the desert and you get to the end and all of a sudden there's this pedestal with a beautiful glass of water with condensation coming down the side. If it was me and I walked up to that and then somebody stepped in front of that glass of water and said, no, this is my water, I'd be like, oh, okay, stab. And I would move them out of the way and then I would take this water and I would drink that water immediately because that is survival. And people getting in the way of survival, they really put themselves at risk. And we know that. And actually, we'll kind of accept that. When people are looting stores when there's a famine, or when people are doing what they can to survive for their children or to not die, we accept those things. What about an addiction? We took patients who hadn't had their drug of choice, and in these cases, for these studies, it was alcohol and opioids. And so when we took those patients and we put them in a functional MRI and we asked them a couple of basic questions. Tell me about the first time that you used your drug and the last time that you used your drug. That's all we really asked. That craving of just thinking about the drug lit that brain up. And it lit it up no matter if you were 30 days, 60 days, 90 days, or 1 year. It was almost exactly the same. That craving signal in the brain did not decrease until 2 years. And what we found was the relative size of that craving was not a baseball or a basketball. It was a baseball field. So the craving for dopamine and that drug of choice so far outstretches the desire to not die from dehydration and starvation that it starts to make me understand why these behaviors happen so consistently among patients who have had the disease of addiction.